this week as the world marks International Overdose Prevention Awareness Day. South Africa is grappling with a rising but largely hidden overdose crisis, and experts are warning that most overdose cases even go underreported or unreported even due to gaps in data collection as well as a lack of national tracking systems. And to shed further light on this urgent issue, let's now extend a very warm welcome to Ms. Julie Mac Donnell from the South African Network of People Who Use Drugs, who wrote the Pregnancy and Substance Use Toolkit with funding from the Elton John Foundation. Oh, wow, Julie, great having you with us on the show. So please, first of all, help us understand what this day is all about. And of course, in the South African context where the CDC is now rumored to be highlighting the concerning rise in stimulant-involved overdose deaths, noting that stimulants are actually now involved in most fatal overdoses.
Absolutely. Yeah, we're starting to see a shift, not only in an increase in opiates and heroin overdoses, but we're also slowly starting to see an increase in stimulant use. We've had some cocaine overdoses. We've heard stories of methamphetamine overdoses as well. So we are starting to see a slight shift in the patterns of overdoses in South Africa.
This is quite interesting, Julie. But what could be those most commonly used drugs that are actually leading to overdoses? Because as you mentioned, opioids and heroin are most synonymous with the United States, for example.
Yeah, so unfortunately, or fortunately, I should say, we're not having the fentanyl overdose and the fentanyl crisis that we're seeing in America and in Canada. That's largely something that's not affecting us in South Africa, but we need to remain vigilant about it. Our police and our SANEB officers are always keeping a close eye on the patterns and trends of drugs coming in. Fentanyl is a synthetic opioid along with xylazines, and fortunately we're not seeing those. If they were to start coming into South Africa, we would have a huge crisis.
Absolutely. But Julie, why are these overdose cases underreported according to your research and available data? And why are we still lagging in terms of a national tracking system as compared to our global counterparts?
So I think one of the big challenges we have in South Africa is that drug use is still severely stigmatized. People who use drugs are not feeling comfortable accessing available services through healthcare systems. We also have the big challenge of not having naloxone, which is the sort of antidote to reverse opioid overdoses. That's not available to your average civil society. That's only available through prescriptions. And to first responders. So that's a big challenge that we face. There are a lot of people that are using drugs that are not, as I say, not accessing medical services. So we're not getting to hear from these people about opioid overdoses, but also opioid poisonings. We know that oftentimes it's not just overdoses, it's drugs that are contaminated with other harsh chemicals, which leads to kind of poisoning of the system. Which is also can be incredibly harmful. People are just not reporting these. They're not accessing the services because of fear of discrimination. Yeah.
And we understand that treatment facilities are very expensive as well, Julie. So where are these substances easily available to these users? Are there economic, social, or even cultural factors that are actually responsible or enabling for this huge influx of drugs accessibility, especially in impoverished communities, often accompanied by GBV and other social ills, and filter right down to children? Julie, we recently saw a very harrowing video of a couple making their toddler inhale what was actually believed to be drugs doing the rounds in the news, highlighting the parent-to-child drug abuse cycle.
Absolutely. And that's something that I feel very, very strongly about. We need to be protecting our children and not harming them in any way. And that's something that's a significant challenge, I think, because of lack of service availability in our country. We know also that the US funding has significantly been we've experiencing significant cuts to funding in South Africa at the moment. And that directly impacts the vulnerable people that we're trying to service. The kind of rural and remote clinics were often funded by EDCFR funding. We also know that the most vulnerable people are always the one hardest hit by substance use because of trauma, because of socioeconomic factors, unemployment, poverty. Yeah.
Absolutely. And speaking of funding, I mean, let's talk about some mechanisms that you are aware of that are currently in place by organizations such as yourselves, Julie, in dealing with and combating the scourge. I mean, through multilateral collaboration and, of course, in alignment with your key objectives, that is to ensure the voices of those who actually use drugs actually take part in shaping drug policy in the country, as well as funding and research programs.
Yeah, and I think it's essential that we are starting to work more collaboratively. For years, the drug sector in South Africa has been led directly by Department of Social Development, and we're really needing to expand on that. And I think we're slowly starting to see a shift where we're having Department of Health coming more on board. We're working closely with law enforcement, with Department of Justice. We're doing a lot of capacitation with them. And we realize that a multifocal a multi-sector approach and a multi-sector point is the only way to go forward. We need to be working collaboratively to address substance use in our country, and shift the way that we've seen it as something that needs to be penalized of people that actually need help. That, you know, we need to be addressing this in a manner that's helpful and not harmful.
And how do we, I mean, get around the issue of stigmatism? As you earlier indicated, Julie, this is often the biggest barrier to the users or sufferers actually seeking the necessary interventions as well as treatment. We've seen families actually struggle to try and even get anybody assigned to assist, be it a family member or their child that is using drugs.
Yeah, that's the huge challenge that we face in South Africa, the actual lack of service facilities. We have very few treatment facilities, inpatient facilities, especially out in rural and remote regions. But more challenging than that is in public health facilities, the staff are not necessarily capacitated to manage these challenges, especially around substance use. So Stanpud, together with TB HIV Care, together with NACOSA and other NGOs and civil society organizations, we're really working hard to capacitate public healthcare facilities and other medical NGOs that are operating around our country on how to work more effectively with vulnerable people, like people who are using drugs, like sex workers, like people living with HIV, so that we can capacitate them to the best of our abilities and get them the health, allow them, educate them on how to offer best practice to the people that most need the help.
Let's certainly hope that we see quite a lot of campaigns, awareness campaigns that are centered around this, and see a lot more of you, Julie, of course, delivering this message that you can still recover and get treatment, and that the communities as well as families also play a very crucial role in stopping the cycle. Thank you so much, Julie, for that interactive discussion there. That is Ms. Julie Mac Donnell, Stanpud, on SA's hidden rising overdose crisis.